So today I'm going to be answering the difficult and challenging question that I get asked often, which is what contributes to young people's mental health problems? And are mental health problems on the rise in young people? So yes, mental health problems are on the rise in young people. It used to be when I started out in this work, the surveys that we had, which are not extensive, were saying 1 in 10 children and young people experience a mental health problem. After the pandemic, it was 1 in 6. But I know from speaking to teachers and people who work with children and young people every day that they are telling me that wellbeing issues are getting worse and mental health problems are increasing. So what's causing this? Multiple different factors, and we can't just think of it as one thing. Social media often gets blamed as the reason why young people are developing mental health problems. That is just one of the contributory factors that could be causing mental health problems within that particular individual. So I've seen a very interesting tweet that summarises a lot of this stuff. So I wanted to talk through what's on the tweet and from my opinion and from what I'm thinking, how I'm seeing that in my work with schools and organisations. So the first contributory factor. So when we think about well-being, we think about it as a dynamic process of strategies that are within the individual and within the system and are teachable and learnable. Factors within the individual that enable them to feel good and function well, and factors within the system that facilitate their ability to feel good and function well. So if the system that they're operating, or they don't learn any skills that are actually taught to them through relationships and interactions, or through lessons, or through practical programs, or anything, they aren't going to have the skills to flourish, because we can't just assume that it's just going to happen by chance, which is what we're doing right now. We're basically throwing children and young people off a cliff and hoping that some of them will figure out how to fly, and some of them will crash and fail at the bottom, and hopefully, if they're lucky, an ambulance will drive past and pick them up and then make them feel better. But the one thing we know about mental health cures, there isn't really a cure for a mental health problem. Mental illness, it's more about maintaining that condition and stopping it from getting worse. So what we want to do is prevent these issues happening in the first place. So what's contributing to these things, so that we can start to look at these factors and look at them from more of a preventative lens. So number 1 on the list on the tweet that I saw was increase in social media use. Now, it's not just the use of the social media, it's the type of social media. When I was teaching at the university, one of my third year students did a very interesting research project. She was looking at, I always hope that she would publish this because it's so fascinating. She was looking at social media use for uni students, and how it impacted their relationships and social interactions. And what she discovered was it's double-sided. Without having the social media and the connections with peers in that way, they don't find out about stuff and they miss out about stuff. But if they spend too much time on their phone and on when they're at a party or at a social event, using it as a coping strategy because they're feeling anxious, so they'll get their phone out to distract themselves or soothe themselves because they feel unsafe, because they're not used to building in-person connections, it can actually act as a barrier and a deterrent to stop them making connections. So it's this really nuanced double-edged sword to social media that is not really investigated or looked at. So there has been, the tweet that I saw was a research call for evidence, because we still need to understand so much of this. So yeah, she found out that young people, so they were in their early 20s, so they're uni students, they need social media to feel in touch with their community and find out what's going on, and to build connections, but then that can act as a crutch that gets in the way of them maintaining connections that are deep and meaningful. One of the major contributory factors of that in mental health problems is loneliness and people's inability to make deep, meaningful connections. And the more I work in this space, the more and more I feel that that's the key, that's the solution. And a lot of that's to do with your attachment wounds and your attachment trauma. Again, locally in Leicestershire, there was no service for attachment trauma for children in camps. It just didn't exist. And it's probably one of the major causes of mental health problems, is people's attachment wound issues and learning maladapted coping strategies to deal with that. So the next thing on the list is COVID-19 pandemic. I mean, when they closed the schools, I just knew that they were storing up issues for the future that we're only just starting to see the legacy of that now in schools. I mean, most of the schools I work with are talking to me about how so much the kids that were in lockdown 2 years ago are now in their GCSE year or now transitioning into secondary, and they just can't cope. They just don't have the skills to cope. And that's partly because of the isolation they experienced. The social isolation away from other children or other young people is so damaging. Like, especially adolescents, they need to be with peers. It is part of a developmental stage that is part of being a mammal, not even a human. It's part of like adolescent development for mammals. And they took that away from them and put them in pet homes with their parents at a stage in their life when they're trying to disconnect from their parent, a natural healthy stage where they're trying to sort of separate themselves from that and find their own identity with a peer group, and that didn't happen. So damaging. And we're only seeing the outcomes of that now. So they also didn't learn a lot of social skills and social cues and connection, and like 2 years of not, some kids had 2 years of not having that. Some kids are still not back in school because of school avoidance and emotionally based school avoidance, because they don't know how to cope. They can't face it. They haven't built that foundation. So there's so much work that needs to be done with them to like help them re-engage, and help them learn these basics, core skills that again we take for granted. A lot of primary schools do work on friendships and connection and meaningful relationships, which is great, but then they get into secondary and it all kind of goes out the window. And also they're moving from class to class to class to class, with different groups of people, and not knowing how to just form a relationship on the fly with somebody. Young people don't speak to each other on the phone. They don't even like text. I think they just Snapchat and do all these other apps. That's how they communicate, through images, which then feeds comparison or FOMO, like, oh, all my friends are going out and doing stuff and they're not asking me to do it. What's wrong with me? And that's triggering their attachment wound issues. So it's just layers and layers and layers to this, and everything's connected to each other. Rise in awareness of communication around mental health and well-being, and this also might be linked to challenges reporting and collecting data on health issues. Exploring those kind of topics are of particular interest because there's some really interesting research by Dr. Lucy Folks, who I'm really a big fan of, around is some of the universal approaches to mental health, awareness raising in schools actually causing more harm than good. And one of the worries that I have had with teaching workshops on mental health and well-being is it can actually make some of the pupils feel worse. It can actually just be a one-trick pony, a one and done, and then off you go and nothing changes. It might bring up some stuff for some young people and they can't unpack that because there's nothing else. It's just a one-off thing. So people would approach me and my organisation to do workshops for them, and I tend to try and turn them down now, or I say, well, I'll do them, but it has to be part of a wider piece of work around developing school mental health and wellbeing that's more holistic and actually looking at your staff body and your culture and ethos and what you're doing to then facilitate the ongoing use of those skills. Otherwise what you're doing is just putting the issue within the individual. Oh, the individual can't cope, that young person doesn't know enough, they can't cope, let's cram 45 minutes worth of information into their brain and then they're going to be absolutely fine and they're going to not get depressed. Well, that's absolute flipping nonsense. Like, what other lesson do you teach like that? Do you do maths once for 45 minutes and expect a kid to do GCSE in maths? No. So why do you expect them to do mental health in 45 minutes and then have good mental health? It's just like anything. It takes constant work, constant choice to engage in that kind of effort, to keep yourself mentally well, to not slip into ill-being. Increase of CAMHS waiting lists. Oh my gosh. CAMHS waiting lists are ridiculous. The other issue, it's not CAMHS workers' fault. This is not about bashing CAMHS workers. They are doing their best. They are just, they are part of the system that's trying to help. So it's not their fault. It's the fact that they're chronically underfunded. There's just not enough of them. They're seen as the holy grail as well. Like, oh, well, if we get my child onto the CAMHS waiting list, then they're going to get better. They're going to get fixed. No, they probably won't. They'll just probably work on some stuff that's going to help them cope a bit better, and then you know, they might get discharged after 6 weeks, after you've waited 2 years for that assessment. You know, sometimes young people turn 18 during the time they're on the CAMHS waiting list. They get dropped off that waiting list, they get put on the adult waiting list and start all over again. And adult services are a whole different ball game to children's services. So it's just, the whole system is fundamentally flawed. And the threshold has got so high that you have to be so ill and so in need to even get any support, because there's just such a lack of it, such an acute crisis, that the only thing that we can do is put in place more prevention to stop more young people getting into this position in the first place, that they even need a CAMHS referral. That's something I've been saying since 2009. I am fed up of saying it with nothing changing. All I can do is keep chipping away and keep trying to contribute to the issue and trying to do my best, because that's all anybody can do. So yeah, whilst you're waiting for the CAMHS waiting list, what are you doing? Your mental health's getting worse unless someone is helping you, or you're capable and able to find strategies and resources, or you've got a really supportive family. Chances are, whilst you're waiting, things are deteriorating and things are getting worse rather than staying the same. And I don't know how long they are in my area, but you know, significantly long waiting lists across the UK. Increase in precarious jobs. So as young people are facing the future, a lot of the next points are about concerns about what's their life outcomes, concerns about what's in store for them in future. They're told to do XYZ at school, get this really good GCSE, work hard, and then what happens when they leave? Don't know. There's no jobs. There's a precarious 0-hour contracts. There's the whole gig economy of contracting work, which is automatically stressful because you never know where your next job's coming from. You never know if you're going to get picked. Also, young people don't have part-time jobs like they used to. They don't learn that resilience and learn those skills and get that money and that self-worth from earning, like working as a Saturday girl in a shop, or working in the cafe as a waitress, or like, I mean, I used to be a waitress. I used to do bar work since I was 16. When I was 18, I did bar work. Young people don't have that opportunity quite so much anymore. When I was teaching at the uni and I was working with the undergrads, some of them are doing a placement. Luckily, the university I worked at, the students in the business school were all doing a placement year. That would be their first, some of them. So they get to 20, and that would be the first experience of work that they've got in a placement year. And some of them are in these very nice placements in very prestigious organisations and big corporations and things like that, and that's the first job they've ever had. They've never even like had a part-time job at the weekend or after a paper round, because people don't buy papers or anything like that. So it's this lack of paid employment, or fear of worklessness and unemployment. Like, my background's careers advice and guidance and welfare to work, so I totally understand that. Decrease in income, increased student debt, increased cost of living. So they're worried about the money and future and how they're going to be in. So like financial pressure, financial issues, you know, is a potential contributing factor for young people. If they're from disadvantaged background, if they're from poverty, then that is going to have a detrimental effect on their mental health, because they're just surviving from day to day. If they haven't got enough food, they haven't got any money for school uniform or whatever, then how's it going to affect their well-being? It's going to have a massive effect on their well-being. In fear of environmental issues, like some, you know, worry about the future, or war, or another pandemic happening again. So all these environmental crisis problems, air pollution could also be a contributing factor to young people. So it's not about the individual, it's about how they operate within the system, society, the culture and the world in general. Like, we all have our responsibility to do a bit of it. So just saying teach that kid a few well-being strategies, it's not gonna do much. What else? Increasing academic pressure. Oh, that's a massive one. So I've read some really interesting work from Sarah J. Blakemore, Professor Sarah J. Blakemore, another massive inspiration and role model for me, a neuroscientist specialising in adolescent brain development. And she was looking at the contributory factors to mental health, and she was saying that exams are one of the major contributory factors to mental health problems in young people. Not social media, not any of the other stuff, exam pressure. And also they're putting that pressure on them at the critical stage of brain development. GCSEs should be abolished. What is the point of them anymore? If you have to stay in education till you're 18, why do you need an assessment at 16 that's so pressurising? I just don't get it. I just don't understand. Like, why do we need GCSEs? We don't need them anymore. We need some sort of maybe assessment to help young people identify and narrow down their options so they could, take their learning to the next level, or focus on the things that they're really passionate about and really interested in, and help them decide that. But you don't need an exam that's going to put all that pressure on them for a qualification that most employers don't really understand or rate, because it's more about the person in front of you and their characteristics and their confidence and who they are. And all young people don't have a lot of young people don't have confidence or employability skills because they don't have these opportunities to build them, or they're not very good at interacting with people. So again, it comes back to relationships and connections. Then we have pressure to succeed. So, oh gosh, this, partly it's the education systems need to have high stakes accountability and pass exams at all costs and succeed, but it's not coming from intrinsic motivation, it's come from extrinsic motivation. So if we can help young people find the thing that they care about and that they want to succeed for their own sake, because they want to achieve something for them, and what motivates them and what excites them, what they're interested in, that's going to improve their well-being, rather than passing some arbitrary exam they don't even care about because someone's told them they have to do it, and then put a ton of pressure on them to make sure they do it, and then pressure from parents because they're concerned about the worklessness and about the job market and about their kids earning, or about them going to university and having a better life than they did and all of that stuff, and putting pressure on them to do well because they're driven by this fear that their kid's not going to be able to succeed in the life in future. It's just layers and layers and layers and layers of pressure. And we have these children, these teenage children whose brains are developing, throwing them into the fire, and without helping them cope, without teaching them anything to help them cope. A reduction in healthy habits. So going out for a bike ride, going having a kick about football with your mates, like getting out of the house, going for roaming around, like the ability to explore, because we're so fearful of letting our children out because of all the fear of the news and they're going to get kidnapped, or a paedophile's going to get them, or God forbid something terrible happens to them when they're not in your sight. And I'm a parent, I totally get that. But years ago, we used to be hanging around on the street corner with a bunch of mates when I was 14. I don't see young people do that much anymore. So they're not building these healthy habits of being able to regulate their thinking patterns, or use mindfulness approaches, or exercise, or connect with peers, or just hang about, sit down by the brook and chat. That's what we used to do. I just don't see kids doing that much anymore. And if they do, it's frowned upon, or they're seen as trouble, or they're like youths that are hanging around causing problems. They're not, they're just teenagers doing teenage things. For teenagers, it's natural for them to go about in the evening, roaming around in the evening in a pack. That's what adolescent animals do. And that's what teenagers do. And we frown upon that natural instinct, that natural behaviour. So it can also be healthy food, exercise, really bad sleeping problems, time in nature. So kids that maybe go fishing together or go for a bike ride in the woods together or whatever, that's all really good for their well-being, good for their mental health, and something that they don't do very much anymore. And then family formation changes, family breakdown, loneliness, being like even very affluent children and young people are neglected because their parents are working long hours, they're just left on devices, they might have one parent a single parent household, so they just haven't got someone when they get home until after 5, so they just feel lonely and isolated, and it's not the parents' fault. So there's this really interesting study that happened in Iceland during the pandemic. Was it during the pandemic? Or the recession? The recession. And what happened, lots of people in Iceland lost their job during the recession and were at home with their teenagers more. What they noticed was the teenagers' well-being went up because they were more with their families. And this is what, during the pandemic, some young people's mental health would have been protected and their well-being would have improved because they would have been more at home with their family, more like some of them spending much more time with their family and their connection with their family. So as you can tell, multiple different reasons why young people's mental health problems are on the rise, multiple different solutions as to how to help improve them. In my opinion, the foundation for any intervention that you do needs to be around helping children or young people form connections, be confident to communicate their needs, and emotionally regulate, help them feel safe to build a safe connection with a peer or a supported, trusted adult. That's the foundation for anything. And then we can teach them strategies for well-being around thinking skills, how to feel good, how to function well, how to flourish. And if we do that, we will protect their mental health and we will reduce the onset of this epidemic of mental health issues that are upon us. So this is my opinion based on some information that I have come across, and I caveat that again, that I am not an expert, a clinical psychologist on mental illness in children and young people. I'm a positive and organisational psychologist looking at this through a wellbeing and flourishing lens, but I quite often get asked what's causing these issues, and it isn't one thing that we can just blame and then take that thing away. It's multifaceted. It is a mixture of individual factors and system-wide issues, and we need to really think about tackling that from both sides. So if you're interested in finding out how to work directly with young people to help them, join my coach training course. Look at my links below. There's plenty of resources, free workshops and stuff that you can look at if you're looking at early prevention using coaching or positive psychology, and some resources on my website around strategies to teach wellbeing, so you can at least help the individual learn wellbeing strategies to navigate some of the situations that they might find themselves within, but without looking at the wider system that they operate within, that is going to have a ceiling and that is only going to do so much. So that's all from me today. I'll see you again soon.